All right, so you want me to supply you with like a final disposition report, or do you want me to just like?
Oh, I have 1 minute.
Yeah. Good afternoon. We're about to get started for the health benefits consultant meeting. I'll give it maybe another minute really quickly here just to see who else joins. I just want to do a couple little admin notices. While you're not speaking, could you mute your mic on your system just to make sure we don't get any background noises while the presentation is happening? Okay, well, we'll go ahead and get started. My name is Janina Lewis, and I'm from the procurement office here at the City of Tarpon Springs. And the way we're going to kick this meeting off is I'd like to go around to all the participants that were invited to the meeting and state your name and where you're from so we can have that on the record. And we'll start with our room here. I'm
Jane Niffen from Human Resources.
And I'm Sean Fleming, Senior Benefits Consultant with the Garin Group.
And then I'm going to start with Judy Staley.
Judy Staley, I'm with the City Manager's Office.
Craig Meisner.
Craig Meisner with the Fire Department.
Paul Smith.
He's muted.
Paul Smith with the Public Services Department of the city. Thank you.
City Manager.
Mark LaCourse, City Manager, Tarpon Springs.
Jeff Young.
Jeff Young, Police Department.
Lisa Nix.
Hello, Lisa Nix from the Garin Group.
Catherine.
Catherine Hughes, Account Relations Manager for the Garin Group.
And Nina.
Hi, this is Nina Macon. I'm the account manager from the Garin Group.
Okay. Do we have any others that I didn't see on the screens? Okay, so the purpose of this meeting today is for the Garin Group, who is our health benefits consultant, to provide, they did an RFP for us on the ancillary medical benefits. And today is the results that they have put together for us. And it's up to the committee after hearing the results to make a determination of where we'd like to go from that point. As the consultants, they're only providing input and information. They do have a lot of technical knowledge, which is why we've selected them to be the provider that they are. And I'm now going to turn it over to Sean Fleming from the Garin Group, and he will give us the presentation. During the presentation, he'll probably share his screen view, so it'll be on and off with the screen. So be patient because it takes a couple of seconds for the on-screen to be shared. Thank you.
Great. Well, thank you, Nina, and thank you, everybody. Appreciate you taking the time to be here to go through this today. I know that medical insurance especially is always on kind of the forefront of everybody's mind as you look at costs and expenses. And we have a lot of the other insurances as well. So just a couple things. So I want to thank a number of my team members who are on, especially Lisa Nix, who is our analyst, who did the majority of the work in putting together both these responses, but also the RFP and putting that out. There's a tremendous amount of time that goes in, I think you'll see with some of the items. So we're going to talk about that. I'm going to try to keep things on the more succinct side to try and keep you guys from getting completely bored with insurance. I know it's a thrilling topic. I see some smiles. So I'm going to go a little bit on the quicker side. So please just yell, holler, scream with anything you want us to kind of stop with and explain or in further detail. I'll try and take the lead, and then some of the more technical questions Lisa may be jumping in to answer based on going through everybody's RFP results. So with that, we put out an RFP for a number of lines of coverage. The majority of them, medical is obviously the one that everybody's always most interested in. So we're going to start off with that. I'm going to share the screen here. And what I'm going to do while that's loading up is I'm going to explain kind of our layout to y'all on the first page. And then, so it'll probably take a little bit more time with that and then jump into more details as I go into the later pages. Does anybody see anything? No? Did I do something wrong, Janina, do you think?
No, it should, once you plugged it back in, it should have went back on.
Yeah, it was just on.
Not getting anything. Try it one more time. You may have to,
There, I hear something. There you go.
Oh, there we go. All right. Hopefully you all are able to see that now. So we're going to jump right in. The first page. So I know this may be hard to read a little bit. I will zoom in some spots and then zoom back out and try and keep the flow going here. So on this page for the lines of coverage, we have a couple documents we're going to look at today. This is just a summary that shows everybody that received and responded to part of the bid in this line. So if to take an example, just how you read this, Aetna, anywhere where you see a check mark, that's a line of coverage that Aetna responded to. If you go on to the next line and you look at Ameriflex does not offer medical and dental insurance. They're just an FSA and COBRA vendor. So we have just what they responded there to. I know that you guys are more interested in seeing the actual results, but this is something we compile so that when we go to the board and when we do the write-up, you know, everybody that responded to the bid. So the first thing we're going to do is jump into medical, and I want to explain a couple things we did in medical and why we did them. So the first thing we do with medical is we always go out and ask for a medical plan trying to match your current schedule of benefits as closely as possible. The reason we do that is everybody may not be able to match everything exactly, but we want to have the most apples to apples comparison that we can have to see how one program compares to another. So one inherent challenge in that is you all have a clinic that's offered through your current plan with the Florida League of Cities. A number of carriers that would potentially want to bid would not be able to respond with a clinic, so we really wouldn't have a great apples to apples comparison. So we actually asked for proposals, you know, from the League of Cities, both with and without a clinic, so that we had that benchmark. So I don't want anyone to interpret that as that was to get rid of the clinic or anything like that. It's just to give us a benchmark so you all can make an educated decision in looking at the results. The other option that we asked for is we asked for a plan that would provide similar benefits to a clinic without having a clinic. The way we potentially achieve that would be by removing copays from primary care and from generic pharmaceuticals. So that's another way to give us a little bit of a barometer on that program. So with that, now that I've kept you in suspense enough, the first thing we have on this page, I know everybody's going to go to the bottom, so I'm going to read the bottom first, and then I'll tell you how to read the page. So the League of Cities on your current plan, keeping everything exactly the same with the clinic, provided a 2% reduction to the premium rates. Overall, that's a savings of about $86,000 for the year. So now that you guys have looked at that, let me tell you what all these lines mean, just so you have a quick understanding. Down the left side of this page, we break out different benefits on the plan. Deductible, out-of-pocket maximum, hospital, non-hospital services, hospital, mental health and substance abuse, and then pharmaceuticals. I'll talk about this kind of divide in the pharmaceuticals as we go down with some of the other carriers. There's some differences in the way that they do things. So overall, what you would do here is you line up, for the most part, most of your claims are going to be in network. You line up this in-network column. If you want to know what the single deductible is, it's $250.
Pardon me here, Paul Smith here. Is there a chance you can do some zooming and scroll as you talk about the things? I have no hope of reading those numbers. Oh, that's much better.
All right, that better?
Yes, thank you.
Okay, good. So what I was saying, if you want to know what the single deductible was on a plan, you go across this line in network, you have in and out of network benefits. Hopefully nobody's really going out of network because we never want to go out of network unless it's an absolute last choice. That's your deductible. Over here is the renewal plan. So as you all will see on your current plan, everything is exactly the same. Now you may think I skimmed a little fast to read and realize everything was exactly the same. When I show you some of the alternates, what we do is any benefit that we think is an enhancement, we're going to put in blue. Any benefit that's a takeaway is going to be in red. So you'll see that in a couple pages. But overall, the League of Cities left everything the same, and you have a 2% reduction to the overall premium. Any questions on that from anyone? So giving us our benchmark, by the way, hopefully everybody likes that result, right? Hopefully. Virtual high fives, thumbs up. Okay, good. So we asked the League of Cities if we didn't have the clinic, what would your rates be? So that we had something to compare to every vendor that wouldn't have a clinic. So just to give you an idea, because when you go to the clinic, you save the medical plan money and there's a savings and an offset there. There wasn't a big price difference, but if you chose to just keep the medical plan without the clinic, it's a 4% reduction. Anybody have any questions on that? So what I'm going to do now, and you guys stop me with questions. Hold on, I think I advanced too far. Is we're going to talk about the alternate plans that were received. But I'm going to tell you, so what most of our committees and most of our groups are going to keep in mind is where that renewal came in versus current. So for the most part, when we have vendors that have a pretty big disparity from that number, I'm not going to spend a ton of time inundating you guys with all the different details of those plans. Because the reality is if somebody's an increase of 5% and you've got a 2% reduction on the table, you're not going to move in that situation. But so any questions you have on any of these, stop me and ask. So next we had Cigna. Again, no clinic. You will see on this page, the only real change is they allow you to get a 90-day pharmaceutical supply at a retail pharmacy. So that would be a little bit of an enhancement over your current plan. That's why we have it in blue versus not covered. If you see that. But Cigna proposed a 5% increase to your current rates. So that's about a 7% spread from your current renewal. So we're not gonna, I'm happy to answer any questions you have on that, but there's obviously a pretty big spread there from your current program. All right, so next, alternate 3 is Florida Blue. So Florida Blue, as we go down the schedule of benefits, they matched your deductible and out-of-pocket maximum and co-insurance. They largely matched your schedule of benefits. A virtual visit with a specialist, though, is $40 with Florida Blue. So that would be a takeaway. That's why we have that in red. Another one that's a pretty significant takeaway is outpatient hospital. So if you went to the outpatient hospital right now, you owe $100. With them, you would have to pay 10% after your $250 deductible. Being that more and more services are moving outpatient these days and less inpatient, that's potentially a pretty big detriment to employees that end up using that service. Under mental health, Florida Blue, so a number of years ago, there was a law that passed, I think it was 5 to 7 years ago now, called, maybe longer, called the Mental Health Parity Act, that basically said you can't charge any more for a mental health inpatient or outpatient visit than a regular visit. And a lot of questions came up on what that meant. Florida Blue, for lack of a better term, just said, we're not really sure how to interpret this law, so we're going to err on the side of caution, and we're just going to make all of these services free. So you see that enhancement on Florida Blue, that all of their mental health and substance abuse is no charge. Overall, it's an important benefit, but it's still not going to be a huge cost driver on your plan. There's definitely more focus on mental health than there has been in the past, which is a very good thing. But overall, as to how much impact that really has on your plan, it's probably not that much. On the inverse side, that outpatient hospital is really going to affect a big percentage of the population each year. So Florida Blue is a 5% reduction. So you may think in your head, well, that's 3 points better than the 2% reduction that the League of Cities gave us. But the reality is, because this doesn't have the clinic, you'd really be comparing it to that -4. So you only have a 1% discount if you wanted to make them apples to apples. And for that 1%, anybody that goes inpatient hospital is probably going to make up a big portion of that. So although it would potentially be saved on payroll contributions, it's coming out of the employees' pockets and the inverse for that. So I'm going to go back to Zoom in. Sorry about that, guys. But does anybody have any questions on that Florida Blue option? All right. So our next alternate is going to be alternate 4 with Humana. So you'll notice with Humana, they're out of network. schedule of benefits are quite a bit worse. You see all the red there. It is a takeaway. I would not make a lot of my decision though based on out-of-network benefits, because overall we see 99% of claims in the in-network level. If you go out of network, for some of you that are or aren't as familiar with it, you have the potential to be balance billed, so you have no protection. So we really always want to have a carrier that has an adequate network. But overall, a couple of changes. They would have a $20 charge for telemedicine. They gave you an enhancement of $35 on the specialist. But again, they have that pretty big takeaway on both outpatient surgery being $100 and traditional outpatient hospital, which more than likely is gonna fall under surgery, but you could have somebody go in for outpatient testing. They have that, they're gonna go from that $100 copay to 10% after deductible and coinsurance. And Humana is an 8.6% increase. So they're not as attractive as a couple of the other options that you have. So I'm not gonna spend a lot of time on that option either. So the next one, we'll start on the bottom, is Aetna. They came in at a 6% increase, but they also set their rates contingent upon seeing updated claims experience. So what that means is, let's say that you have a claimant come on the plan with a very high cost condition. Since we did the bid, those rates could potentially be re-rated. So they're not firm in that regard. And they're a 6% increase. Most of the time, we see those rates hold, they don't raise them. But I would also say that they rarely ever reduce them. So the 6 will probably not turn into 0, but it could turn into a higher number. I'm not saying it can't, in full fairness, but there's more than likely it would go up or down based on those updated claims. So does anybody have any questions up to this point? Because now I'm going to show you some alternates. I don't hear anything, so I'm going to keep going until you guys stop me. So as we said, we asked both your current carrier and other carriers if they would look at an option that was comparable in some ways to the services that the clinic offered by making no charge primary care visits and no charge preventative generic drugs. Now the clinic actually probably carries some generic drugs that are beyond preventative. Some of the carriers that bid only have that option of no cost preventative. So the League of Cities is a 2% reduction if you go with that option with the enhanced schedule of benefits, but without the clinic. So what the League of Cities is really telling you there is whether we give you these visits for free or we give you the clinic, it's all the same cost because we're going to pay for it one way or another. And I want to make sure that's clear because I don't want anyone to think, oh, it's a negative that they weren't lower on this or anything like that, because what the clinic does is it shifts costs out of the medical plan. So if we take that clinic option away, all those costs that we shifted out of the medical plan have to come back in. So that's why those options essentially are priced the same. So overall, either way, you have the 2% reduction. The only thing I don't know on this is I know there are some other costs associated with the clinic. So if you were to choose to go this option, there might be a little bit of other savings, maybe on the administrative end, the lease, all those things. But I know it's not a substantial number in the grand scheme of things, but I want to make sure that we fairly hit on that. Oops, so that did not work. Not hit that button. So Cigna gave you a similar option. Again, you'll see the two areas in blue, everything else the same. That was a 5.3%. So it's just slightly higher than their other program. Florida Blue, so this is, I think, the most interesting of them. So Florida Blue, remember, who was at a 5% reduction. Florida Blue gave you this option, no charge preventative, no charge on that. But their rates went up 6.8% to jump to that option. I am not sure why. I will tell you from other entities where we've looked on this, we have software where we analyze claims. It's probably worth about 0.5% to 1%. So I don't know why the 6.8% jump. I don't know if they're being overly cautious, assuming what the clinic is doing, but that was a pretty significant jump on their part.
Do they have much experience with clinics? Because usually that's a sign of perceived risk when they add a little bit more than you expect.
Yeah, so what I would say is most of the carriers that have experience with clinics, I'll use City of Clearwater as an example, one of our clients. So City of Clearwater is self-funded on the medical plan. So they pay the claim. So most groups that have a clinic are self-funded. So the carrier isn't exposed to the risk either way. Not that many fully insured groups have clinics. So to answer your question, yeah, I think part of that is probably fear of the unknown. I think right now everybody's a little extra scared of the unknown because of COVID. So, I think that plays into things a little bit as well. Some of the proposals I thought were very aggressive, some not as aggressive as you might have seen in other years. And I think that is because of COVID. And they just really don't know what that overall exposure is going to be. And I think what really comes into play there is, do you end up, we know that certain percentage of people are going to get it and are going to be impacted. I think what the carriers don't know is, okay, of the people that get it, what percentage are going to end up hospitalized with an expensive bill, and what percentage of people are just going to go home and isolate, take Tylenol, cold and flu, and then be back to work. And that's what I think they're all struggling with right now, is they just don't know. What I will say is anybody that's your current carrier right now is getting a discount, because anything elective, non-critical, all those things, right? They're not paying claims right now. So they're all getting a discount. I think from a bid point of view, though, what everybody's asking is, if I take a group on October 1st, and that's when things open back up, am I going to inherit the last 6 months of claims that were delayed? And how do I price for that? So I think that's overall what we're seeing going on in the market. And then the last one was Humana. They did not remove the copay for the office visit, but they did remove the pharmaceutical. And ironically, there were 2.4% increase on this plan, but they changed some other things that were takeaways as well. So overall, looking at your renewal, looking at the option with the League of Cities, this one still had a pretty big spread between those. So in here, we have a number of caveats that were provided from each of the carriers. Some of the carriers offered some wellness funds. I'm not gonna run through all these line by line. The big thing is you have Cigna and you have Aetna that were contingent upon receiving other rates. And I apologize, I might not have said that with the Cigna proposal. And then a couple of these, there's some discounts if you select all the products, but overall, some of those still probably would not offset the price impact. So before I kind of open it up to discussion on the medical, I want to put one page up here and just talk about this. This is what we call a disruption analysis. So what we look at is based on employee zip codes and dependent zip codes, what is the access and average distance to here, the standard criteria is to providers. And what we look at here is if we had a really low number, that would tell us either that the carrier had a inadequate network, or it also would tell us maybe, let me give you an example, if somebody has a dependent, even though it's fine here, somebody has a dependent in an area where that carrier doesn't have a network, that would help us identify them on this report. It also can be very useful if you have out of area retirees and you had a plan, as an example, that was only in Florida. This would give us that identification. I am not going to spend a lot of time on this because, as you will see, on primary care, OBs, specialists, just about everybody is at 100%. Urgent care, you know, you're at 98 to 99%. 100% on hospitals, 99.7 with Florida Blue. So overall, everybody that proposed has an adequate network to service the employees at Tarpon Springs. The big thing I will say, although you have adequate access, just to keep in mind is, so Cigna, you know, Aetna, FMIT with United, Humana, the MPOS, those are national networks. Florida Blue Options is a Florida network. Now that probably would not affect many of your employees on a daily basis, but I always think worst case, because I'm an insurance guy. And I always think, what if I wanted to go to Johns Hopkins? What if I wanted to go to Duke? What if I wanted to fly out to MD Anderson in Texas? You know, what if I wanted to go to California because there's some specialist? I was talking to an employee this morning who needs to send a child to Mayo Clinic, specifically in Minnesota, because that is the only doctor in the country that specializes in her child's condition. So something like that, although I think it's rare, you know, having a national network potentially versus a smaller network is definitely something to consider. You have that currently with the league, with the United Healthcare Network, one of the biggest networks in the entire country. So let me just see what my next. So those are the end of our medical pages. So I'm going to unplug for a second so we can see everybody, and wanted to kind of open it up to questions, comments, concerns, feedback, where anybody is comfortable starting.
Well, I'm good as city manager. I'm happy with it.
This is good validation that we've got a good value going with the league. So as I understand it, it's without the clinic. Only one was significant, not even significant, slightly cheaper, Florida Blue. But there were some things there that would be not so good for our employees. So to recap, it looks like the league right now has the best offerings based on the analysis.
Yeah, I would agree with you, Paul. I think Florida Blue with that inpatient could financially devastate some and one of our employees.
Yeah, I mean, I don't know how much the procedure is. I'm gonna guess $60,000 for something. That'd be 6,000 they'd have to come up with out of pocket.
Yeah, that not good at all for the employee.
Can I speak?
What's that?
Can I speak?
Yeah, go ahead, Tim.
Okay, I'm looking at it from the employee perspective and also from the city staff perspective. To change carriers and the amount of work and cost involved in administrative costs, time, et cetera, the 1% difference would easily be eaten up by salaries that people will have to do. We'd have to re-enroll every single employee and all their dependents, make those switches for something that's 1% and has a few unknowns. I think that the plan we have right now is probably the best balanced of the plans that we've just looked at.
Judy, Craig, do you guys have a thought, any input?
I was wondering if you had any graphics that show the alternatives that FMIT proposed, because I know there was 2 or 3 different alternatives there. Comparing those to each other.
So the alternatives really were, and I'll read it off and I can put it back up if you want. So FMIT did not propose a complete different schedule of benefits. If that was something you still wanted to look at, we could. If you tried to ask for 3 or 4 options multiplied by the number of carriers that would respond, with and without clinic, we would be here for till midnight. So, and I could put this back up, but basically it's -2 to stay as is, -2 to get rid of the clinic, but have no cost for the doctor and the generic drugs. And then current schedule of benefits, get rid of the clinic completely, is -4. So if that, do you want me to put it back up or does that kind of simplify?
No, that was what I was looking for. Thank you.
Okay.
So the key on that is really that to get the biggest cost savings obviously would be to get rid of the clinic completely, but that's obviously less beneficial for employees. Or to get rid of the clinic and keep some of the things that the clinic does that through your own doctor with the same savings, or just keep it the way it is with the same savings and the clinic.
Correct. Yep. And so as I kind of teed off with, we didn't ask for those options to promote any of them. We just wanted you all to be able to compare on an apples to apples basis. We've reviewed the clinic data, and based on the utilization and based on, the amount that the employees are using it, the amount that, ultimately is being built into the medical, I think you're getting a good deal on the clinic. Clinics are less about the cost and more about how much you use them for that cost. And I'll make up a number. If you paid $100,000 a year for a clinic and one person went all year, I'm going to be extreme for an example. You just cost $100,000 a visit when it probably costs $110 on the medical plan. The flip side is if I have 10,000 visits for that same amount of money, I'm not that good at math, but I think you guys see the point, then your cost is very low per visit. So what we look at more than anything is with the cost that's being, looked at for the clinic and what you're paying, are we in a situation where we're at least at a break even, where that average is basically in line with the medical plan? Because then even at a break even, I'd always offer a clinic because I've got a better benefit. If I start if my average cost of a visit in the clinic is $500 and I can get on the medical plan for $100, then I've got to really evaluate, does this make sense for me in that regard? Had you got a 10 or a 12% increase with your renewal, we might have to be diving into those numbers in a little bit more detail to say, are we still making the break even? But at a reduction, you know, we're more than confident that you're getting that value out of that. So I don't have any concern in that regard.
It's been a while since I saw the first slides, but each percent is worth somewhere around $35,000 or $40,000 a year. Is that about right?
Well, let me find two that are close. 173 and
Basing that off, I think it was almost 40.
yeah, there was 173. The 4 versus the 5 was 173 versus 217. So is that 25, 28, and 17? 45,000. Yeah, about 45.
Okay, thank you.
Would have been a lot easier for me to look at the total and do 1% of that, but I took the long way to get there today.
Do we have any utilization data for the clinic currently?
I don't have it with us today. I do have copies of some of the annual reports I believe that the League of Cities and Carriage Sea have given you. And I don't remember, Dane, I'm trying to remember when the last update was. I don't remember. I may have to ask for it. I think they sent it to me. I could try and look it up later. I think it was through last fiscal year. We can have that as a takeaway though. So do you guys, and Janina, don't let me say anything wrong here. Do you want me to keep going? Do you guys need to vote today? Do we have a separate, I'm just trying to figure out how you want to structure it.
So in this particular case, do you feel we have enough information to make a decision, or do you feel that you need the clinic utilization information to be able to make an evaluation? That's the key. Because you're looking at your costs with or without the clinic, and basically it's a 4% versus 2%. And if we see what the clinic utilization has been in the past, that might, you know, sway it either way. So I'm gonna leave that up to the panel.
It doesn't sway me, so.
Okay.
And it's very simple. We saw how many people with the city didn't even have a primary doctor they were going to. They didn't even get preventive maintenance. They didn't even get checks. And it took us a long time to get the people, but we have so many people going to a doctor regularly than we've had before. And I don't care what the money, that's one of those things you can't price with money to save yourself from catching our employees with stage 4 diseases or something like that. When they tell you, oh yeah, I haven't seen a doctor in 8 years. Well, that's why you're in such a serious condition. So beyond the money and the everything, the human element of knowing the people in our city who will go now and get checked up and do the yearly thing. You know, I don't need to see the utilization. I don't know if anybody else does, but I don't need to see it.
And that's not just employees, but also their families as well, right?
Yes. And we know the employees they've caught things on that probably wouldn't have gone if that availability wasn't there. They may not have caught it, and we may have a worse situation and stuff. So.
Okay, so then I'm going to put it back to the panel. We'll start with Jane, and then we'll take a consensus.
I feel confident that the clinic, the plan that we have right now with the clinic is probably the best option. If there's only a $45,000, $50,000 difference between that and something like Florida Blue, the disruption to your employees, the fact that you don't really have a clinic, we have spent years getting them to go to this clinic, and now that they're going, it doesn't seem fair to take it away. So I would vote that we keep the current plan with the clinic.
Judy?
I concur with Jane.
Paul?
Yeah, I think it's one of the easier decisions, easier recommendations. I agree.
Craig?
Yep, I agree. It sounds like the best option at this point.
Okay, and Jeff?
I concur.
Okay, so we're all consensus to move forward with the current plan that we have, and we will present that going forward.
All right, let's try and plug back in here. So now it's not quite as easy, but here's what we've done. We're gonna do dental next. I'm gonna tell you what we've done. We have a number of pages of dental. Lisa has ordered those pages based on price from lowest to highest. So with that, we'll probably stick to the first couple pages, and that will help us get through a little bit quicker. I'll summarize. So hopefully you guys are able to read that. Just tell me if you can't. You have your dental through the Florida League of Cities. It's Delta Dental, but run through the trust. You have a $1,500 calendar year maximum. So that means anything that the plan pays up to $1,500 max per year. You have a $50 deductible as a single and a maximum of 3 times that, $150 as a family. The deductible is waived for class 1, which is diagnostic and preventative care, and that is covered 100%. Now, if you go out of network, you have the same schedule of benefits, but you can be balance billed. So I use a round number because I'm not real good at math. Let's say it's $100 for a cleaning and you go out of network, or let's say it's $110 for a cleaning and you go out of network. And let's say that the carrier reimburses $100. So the carrier is still going to cover the $100, but you can be balance billed for that $10 difference. So that's why we try and encourage you to go in network. But remember when I talked about medical and said you really don't want to go out of network, well, with medical, you can get a $100,000 bill and you could be on the hook for $10,000, $20,000, $30,000. A lot of people do go out of network with dental collectively. I don't know as much with the city, but a lot of people do go out of network with dental, especially in certain areas where there's not a big number of providers that they like that take insurance. So we do look at the out of network a little bit closer with dental than we do with medical. Class 2 is your basic restorative care. That's going to be covered at 80%. So you as the employee pay 20%. So this is what the plan pays here. So the inverse is what you pay as the employee. Major restorative care is going to be a 50% reimbursement. Orthodontia is 50% up to $1,000 lifetime max for children up to age 19. If you go out of network, they're reimbursing on what's called a MAC, which is a maximum allowable charge. This next option, which I'll show you in a second, has INFS, which is in-network fee schedule. It's essentially the same as a MAC. Another way to reimburse out of network is a percentage of usual and customary. So that would be based on what dentists charge in your area. That's beneficial if you're in a very high cost area, if they reimburse 80 or 90%, because it might be higher than that fee schedule. On the flip side, if you're in a cost area where dental care doesn't cost that much, it might be better to be on a MAC or that in a network. So again, reds and blues apply. So your first alternate, again, as I said, we put them in price order, so I'm going to have to skip to the renewal. Your first alternate with Humana, Hold on. Hold on, sorry for the dizziness. I feel like I missed number one with MetLife. Humana is a,
Yes, hi, Sean. I was just noticing that. I'm not sure, but I did notice that the renewals on there nor the first option.
did I load the wrong one?
I don't know.
All right. Hold on, everybody, sorry, hopefully a 5-second pause. Jane and I were talking a couple seconds ago, so I was talking about MetLife. Hold on. Virtual woes. There we go. Same one. I don't know what happened there. Same file name, says it's a copy. I have no idea. All right, let me start over. Here we go, everybody. Okay, so the FMIT came in at a 0.7% increase with your current schedule of benefits. No change, and they guaranteed those rates for 1 year. MetLife, which was our most attractive alternate, matched all of the schedule of benefits. They have a participation requirement of 25% of the employees, but you have 322 on the plan. So I think we're safe. We've got everybody. And MetLife came in at a 15.8% reduction, which is $32,000. Pretty attractive in that regard. I will go through a couple of the other alternates. Humana was a 15.5% reduction. They gave a 2-year rate guarantee and a not to exceed 5% increase in year 3. The next one that was also pretty attractive was the standard at a 12.7% reduction. And those are the pages I'm going to stick to. There are further savings beyond that, but nothing that jumps out to me. The Aetna plan, you know, that's partially, you probably are going to keep those. If you're not going to split that up, that was more based on their medical rates. And then going down United, I've never heard of Bright Benefits. It's the first time we've had a bid from them. Kind of going down, everybody. So I'm going to stick to really the first 2 pages for everybody. Sorry if I made you dizzy. And kind of zoom back in. Based on our evaluation of everything, I think MetLife and Humana would be the top 2 alternatives to your current program. They both have pretty significant dental networks. MetLife has a slight edge on the pricing, and MetLife more than likely probably has a little bit of a slight edge on the network. And I believe Jane told me before that you all at some point did have MetLife in the past.
Yes.
Any feedback, negative or positive, from the employees on that plan?
No, they're pretty much, you know, dental's dental.
Dental's dental.
I'd be a little wary of the one with the 1-year guarantee. I think it's interesting with the COVID, probably a lot of the class 1 isn't going to be happening for a while, right?
Yeah, and so actually a number of carriers, because of that, actually gave credit during this current year. They waived either a month or half a month of dental premium as a way to help out. Not everybody did it, but a number of clients actually did that and passed on that break in this year. Because again, I think under the thought that they're at least thinking right now that by the time next year hits, everybody will be going back, and maybe they'll even be doing a little bit of catch up. But dental's one of those things, you know, I've talked about medical and we could talk about COVID all day long, but Dental's one of those things that there's probably not going to be a lot of making up. So I had my teeth cleaned last week. You know, because of COVID, I had missed 2.5, 3 months. You know, I was past my cleaning normal schedule because they had been shut down. Point is, I'm not going to go have an extra visit because of that. I'm going to now wait 6 months till my next one. So dental has probably gotten even a better break than medical, because if I put off a knee surgery, my knee probably didn't magically get better. I just put it off, and then I'm going to have to still have it down the road. Dental's a little different. That's why they gave some of those premium credits. So on this page, just real quick, we did that same network analysis that breaks out. I'm just trying, I'll do it there. That takes a look at that. Let me just, it goes through, but I'm going to stick to page 1 here because those are, I think, really MetLife and Humana are your top 2 choices in that regard. Overall, they all have adequate network access is the best way to sum that up. And I'm going to go back to
80th.
Is that also a measure of how many dentists basically take, what percentage of them take that coverage?
No, it's not. And so we have a couple of options, but I'm going to tell you that I don't know 100% until we ask what the answer will be. The best case scenario, what we can do is we can see if the League of Cities will give us an actual report of the providers that your employees have seen. And we can ask the 2 carriers to do a comparison and tell us if they have those in network. Occasionally an incumbent carrier, and it's not necessarily, I don't want to paint it in a bad light. It's not that they're trying to be sneaky or anything like that. Occasionally they just will not share that information. So in that case, the only real, you have a couple ways you could do it. The first way is if you know 10 or 15 dentists that most of your employees see, you can give us that list and we'll go and search them out. The other option, but I don't love this option because it gets complex, is you could go to the employees and say, we're considering this change. Here's a link to the providers. Please provide us any feedback. And then I, as the employee, have to go look at, you know, MetLife at Humana's website to see if Dr. Smith is in network or not. That's the least desirable option because not everybody knows how to do it. What's better is if you know 10 or 15 dentists that people see, you give them to us and we do that comparison if we can get option A.
I know a couple in town that probably 40% of the employees go to.
Allen and Johnson.
Yes.
So if what I would say is, you know, depending on your guys' comfort level and where you're at is, if you really know that a lot of them go to a couple of them, we can have a take back and kind of research and bring that as a follow-up to the committee, however you want to proceed.
I do know that when we've also had Standard. The only one we haven't had is Humana. I don't remember any complaints about network with MetLife.
I think overall they're going to be pretty comparable. The other thing is you have a PPO plan. We have groups with the DHMO plans, which some people refer to as only having the dental chop shops. You know, those are more your retail locations. That's where it gets really, really difficult, but you don't have that problem. So we're thankful for that.
Again, I'm going to refer back to the committee. Do you guys feel you have enough information, or do you want to get the dental provider information and have Garing come back with the follow-up on the percentage of providers that are in each of the different networks that we're looking at?
I'm comfortable going forward because, as Paul said, about 40% of our employees go to 2 dentists here in town. And I'm pretty sure that we didn't have an issue with MetLife's network. So with that kind of savings, it's attractive. How many dollars did you say?
32,643.
To me, that's significant because again, dental is dental.
Okay, rest of the committee, Paul, what are your thoughts? Are you ready, for a consensus on MetLife, or do you?
I could go with the MetLife. I would like to know though, if they're accepted by those doctors, and do we have any sense of that? Is that something we could look up quickly? Somebody on the hearings staff?
Maybe, yeah. Do you know their names?
Yeah, though they share an office. It's located on 138 Country Club Court, Tarpon Springs, 34689, and the doctors are Mark Johnson, DMD, and Hayden Allen, ALLEN.
Nina, Katie, Lisa, could you guys see if you could tackle that while we go on to the next line of coverage?
Sorry, I forgot to unmute. Yes. We'll
Okay.
look into that. Sorry about that.
Thank you.
Okay, Judy?
Yes.
Do you feel that you have enough of a consensus to go with the MetLife going forward?
I thought we were looking something up. No? Yes?
They're checking into a carrier for us right now as we're discussing. We can table it and move on and we'll come back.
Yeah, I'll just, Nina or whoever, if you guys want to text me if you're able to find the answer, and then we'll jump back to dental.
I'm okay with it as long as, we meet.
This is Katie.
request.
Sean, both are in network.
Oh, you guys are so fast. Cool. Well, there you go.
I'm good with MetLife, just like Jane said, the reduction in the payments, all good, and it's all dental insurance across the board, so we're good.
And I'm fine with it as well.
Paul Smith confirming yes.
Do we get it with it, or do we Mark?
Judy,
Judy.
do we lose her?
Thought you.
I thought she was good as long as we got the answer to the question. Okay.
Yeah, I'm fine with it.
Did we get Mark?
Thanks, Judy.
Oh.
He's not on the committee.
Oh.
Mark, city manager. He's not on the committee.
I'm good.
Oh, okay.
Thanks, Mark.
I didn't know that. All right. We're right at an hour before we jump into vision. Does anybody want a quick break, water, anything?
Yeah, let's take just a quick 5-minute water break, and then we'll come right back. I'm gonna put this on mute for our room.
So you guys don't pay anything.
Okay, we're back in the main room. Once you're back, just listen in. We're gonna start off the next piece here. And I believe Sean said it was vision. So I'm gonna turn it back over to the Garing group.
You want me to unplug, make sure everyone's there? Or?
Oh, yeah, let's do a quick roll call, to make sure everyone's back.
Uh-oh. Oh,
Got Paul,
is that the system taking its time?
okay, Judy,
I'm here.
okay. I see Mark, Craig,
They had a long haul.
oh, and Jeff. They're still out. Okay, we'll give them a couple more minutes.
Yeah, and it shows there's a couple of people there that looks like
Still out.
they turned their camera off. So they're still on the line though.
There we go.
Oh, okay, I see Jeff. Okay. So we're just missing Craig, I think. Okay, we're gonna go ahead and get started with, the second part of the presentation. There it is.
There he is.
Sorry, I work call again. More COVID stuff. Sorry about that.
No issues, thanks.
All right, everybody. So medical and dental obviously are probably always the two most popular topics. So we're gonna get a little quicker as we go through some of these other lines of coverage. So again, stop me. I'm not trying to dismiss anything. I just want to be respectful of everybody's time. So next we have the voluntary vision insurance. Your current vision provider is IMED. You have the IMED Insight Network. What's interesting about vision in general is a lot of carriers rent the same couple networks. So what you're going to see on here just as we go through is you'll see IMED as the provider and IMED Insight is the network. Standard, as an example, so they have a vision plan, they rent one of IMED's network called the IMED Access Network. So with some of these options that you will be looking at, you may be looking at two different carriers with the exact same network. So just throw that out there. Again, reds and blues indicate any real adjustment. So this is a voluntary line of coverage. You have 123 individuals that take this coverage. 70 with single, 29 with spouse, 6 with children, and 18 with family. The rates overall, we're talking about quite a bit lower dollar amounts than medical. Single rate is $5.59. We actually got that negotiated down a little bit earlier this year that was passed on. So this is based on that newer rate. And then there's a participation requirement of how many they require to have enrolled. So IMED is in rate guarantee until next year, so there would be no change to the IMED plan or schedule of benefits. Next up is the standard using the IMED Access Network. You'll see a couple of areas that are red. So that means the employee would end up paying more if you want polycarbonate lenses. If you want lenticular lenses, which is a very small percentage of the population, there would only be a 20% discount instead of a $20 copay. That's a 12.5% reduction. What I point out about that 12.5% reduction is it is $1,500 overall.
I think it's time for an appointment for me. Can you bring the Zoom up a little bit?
Yep, sorry.
That's all right.
That better? I was gonna say either an appointment or a time for you to request IT get you a bigger monitor. It could be that, you know. You tell them you want one of those one of these flat screens like we got in here. Just ask for that at the desk. So 12.5% reduction. Again, what I point out is that's $1,588 for the whole year. So that's why Lisa put the change amounts on here. So you understand that even though there's a savings, there's disruption, there's changing, there's potentially not having your doctor in network, and you will save 69 cents a month. Are you guys 24 pays? You know, so about, or 48. Okay, so divide that by 4 to get your per pay difference on that. It's a relatively small number, and I'm not trying to dismiss it, but you know, that's a lot of change to save $1,500. As we go on, so I just want to point out, here's Reliance Standard, which is a 9% reduction. You'll see all the red. Whoops, sorry, finger. Sorry, guys. All right, there we go. Sun Life and Reliance Standard, and I lost my Zoom. Hold on. Sun Life and Reliance Standard, although they're 9% reductions, you see quite a bit of red on there, so there's a lot of takeaways for the employees. $5 more on a lens copay, as an example, as a single employee to save 50 cents a month. You know, you save $6 for the year, but it costs you $5 more, you know, in that copay, as well as potentially if you have other things. I'm not sure a lot of employees would want that kind of disruption to save, you know, $1 for the whole year. So that's, I'm keeping it real and putting it in that perspective, but that is an option. Again, going up here to the networks. So Sun Life rents VSP's network. Reliance Standard also uses the iMed Insight network, just like you have now. Next, we have NVA, which is National Vision Administrators, and Unum. Again, Unum uses that iMed network. So you guys see some of the repeats here. NVA has their own network. That's a 5.2% reduction with some enhanced copays. And kind of going on, the options get less attractive as you go from there. What I would say, so a big part of, and then you have the FMIT at a 9.2% increase, but there's no charge on the lenses. So a big part of, I know you guys have always been direct in the past, where you haven't worked with a consultant or a broker, but I do want to throw out here, you know, a big part of what we do is negotiate on your all's behalf. And what I would say is if there's something really attractive to you in one plan versus another, you know, we always have the ability to try and negotiate that. Now, I don't want to, there may be an order that has to go from a purchasing point of view, and I don't know what that is. If we want to try and negotiate, if we have to pick a carrier and then try and negotiate a better schedule, or see what we can do for the price impact, I don't know what the exact process is, but I just want to let the committee know that, that's always an option, that we can try and have something after something's selected, at least, if we want to do that. But if, Janina, if I said anything wrong there, let me know with that. I know sometimes you have to still select your carrier first and then you can negotiate with them or move on to the second. I know it's a little different everywhere we go. So do you guys have questions or want me to go back to any particular option?
I like the, was it Unum where they actually had, I'm not sure I totally understand the benefit of lenses. Yeah, but the no charge for the employees is kind of nice. I don't know if anyone else agrees that that might be perceived as an improved benefit.
Which benefit were you talking about?
Alternate 5.
Okay.
Unum or Unum, I don't know how you say it.
Yeah, Unum, but which particular benefit were you talking about?
The blue there. Oh, wait. Maybe I was looking at a different one where it said no charge on all of the lenses.
I think that was the last one.
I think that was the league.
Oh, okay. Okay, but it's complicated. You get better on that, but then
Increase.
it's a 9.2% increase. So I mean, the one thing in looking at this, I'm thinking out loud here for a second. So that's going to be for the lens. Now you do have a slightly better, you have a slightly better contact lens allowance. You still have the frame allowance that's the same. So the only thing I would say is, as anybody knows that's wearing glasses or has a pair, is keep this little bit in perspective. Your biggest cost is normally the frame, not the lens.
okay.
Seems like it should be the other way around, but they're both a piece of plastic, but for whatever reason, now the lens is where most people really, and we can't spreadsheet all of that, where most people really start getting dinged on the lenses is, oh, do you want the anti-glare? Do you want the anti-blue light? Do you want the anti-scratch? And all of a sudden, a $10 pair of lenses cost you $250. And then they're trying to sell you the Gucci frames for $1,400. And you're saying, I just want a pair of glasses to be able to see.
Yeah.
So keep that in mind just a little bit, that, the lenses overall aren't normally your biggest cost driver.
I do see one thing under that same UHC where it says under frames, retail, it says 30% off balance. That's better than I see some other ones. What does that mean? 30% off what's left over that you have to pay?
Yeah, so basically, let's say you go in and you buy a $500 pair of frames, you're going to get $130 towards that. And with that option, you're going to get 30% off the remainder.
Yeah, I mean, that's pretty good. That's better than 20.
Yeah.
I don't have this page up with the current offer, but.
The current's your column right here on the left.
Oh, okay.
So it's 20.
Okay. Yeah, and I know it's a little more money, but per month, but what was it, like 10% of $5.40, so 50 cents a month or something more, or per pay, I guess that is. So yeah, you'd be paying an extra $30 a year for that extra plan, an employee by themselves.
Sean, I know that American Fidelity marketed the IMED. What would happen with Unum? Would we have to deal directly with them?
Yeah, so with Unum or any of those, you're going to deal directly with kind of that top line. The bottom line is just who the network of doctors is.
Okay.
So you would still, like you know, let me get to a better example, right? If you took Emeritus as an example, just because they use the IMED network, you'd be dealing with Emeritus.
Well, I just found that interesting as a possible benefit, but it does cost a little more. But I'm willing to go with the group on what they think, and I don't want to hold this up any more than we have to.
You ready to move to a consensus on it? Any other questions? And this is an all voluntary benefit, like people elect this, so
Yes.
it's not,
Yep, they don't have to take it.
okay, okay.
Is there a minimum enrollment on those? The others?
Yes, but I think the highest, so 20%, what's your total employee count? 3, ballpark, 50?
Yeah.
So 70 people, so you've got a pretty good threshold over.
Okay.
I'm trying to see if 51, so now Unum, what I don't love is 37%. When we see a weird number like that, that 37% is probably what 123 is my guess. When we see a weird number like that, that's normally their way of saying current enrollment. So the only thing that would scare me with one like that is, let's say employees looked at it and they said, gosh, I don't like this network. I'm going to drop this coverage now, and you lose 5%. Now you'd be under. Where like MVA here, 51, I'm not ever worried that you're going to go from 123 to 51. I don't think you're going to change that much. Do I worry you could go from 123 to 113? Potentially. Let's just skim and see. We got none, 3 enrolled. Gosh, finger sensitive.
It's before tax, so that means they can't drop it in the middle of the year?
If you take it pre-tax, correct.
IMED is currently pre-tax.
Yep. Then, yeah, you can only drop once a year or a qualifying event.
So one of our options is to stay with the current. Is it being honored for one more year?
Yep, you're in rate guarantee for one more year. You know, if we're able to negotiate, we could always try and negotiate longer on that as a best and final. If we're allowed to do that, I don't want to step on any process.
Is that possible?
It's a possibility. We'll have to research it further because this is the first time we've had a consultant within the city
Okay.
for this particular process.
Okay.
So I'd have to find out the particulars and get back to you.
Okay.
So would you prefer that we not make an election on this one and come back to it? I'm asking the committee on their thoughts and Jane.
I'm really not, I could go either way.
Okay.
I'm not really committed to either, but it would be much simpler to keep what we have, but then that's not what we're here for.
Okay.
The only thing I would say is if it's an elective benefit, which that it is, right, for eye protection. for your eye stuff. I guess it would be to try and get the best deal for the people who do choose it. Cause I mean, I don't know enough about it. I don't think, cause I haven't had to use it yet. So, I don't know. Jeff has to, I can tell. So.
Actually, I do have it for family plan, and the current one's very easy to use, and the cost savings on one plan up. I'm with Jane to change it. What's going to be the legwork for her office and everything, and is it worth the pennies per month that an employee is going to save on changing everything? Jane, you have input on that?
Obviously, changes will engender more work, but I'm easy on that.
But it's all fractional money here.
Yeah, we're not talking large amounts.
I would say, is it possible if we selected the current one to continue, could we have Garen go back and talk to him and say, hey, we like the 30% off of retail on the frames that some of the other plans are offering? Could you do that for us? Because that $500 frame example he gave is real. I mean, it shouldn't be real, but it is.
And so is the anti-glare and all that stuff, because that's what gets on every set of glasses I have to buy.
So I'm looking to the right to the boss, but if we're allowed to do that, we're happy to try and see if we can negotiate some enhancements and maybe a longer rate guarantee to that current plan. I don't know if you have to select them to then negotiate with them, or if we can just negotiate. I'll just defer to you guys. And
Okay, I think typically it's a selection and then it's negotiation. But what'll happen, we'll have to go back and determine whether or not you guys as the consultants can do it on our behalf, or if it has to come from our office.
Okay.
I'm good with that.
Okay.
Well, then I'm okay voting to stay with the current plan, and then I guess however you guys want to revisit negotiating with that current vendor. At least that's my opinion.
Paul Smith concurs.
I concur.
That's fine with me too.
All right. You good?
Mark, do you have any comments? I don't know if he's
Just gone.
Oh, okay.
All right. Okay, guys, so I will say this. I think we've got through medical, dental, vision are normally the three big ones. So I'm going to try and go fast here and see if we can get everything else in the next half an hour. So we did bid, we bid all your lines of coverage. We bid the EAP, which is the Employee Assistance Program. We got a number of proposals back. Your one with FMIT is included in the medical premium. So one of the reasons that, and that's correct, right? Yeah, okay, just making sure. Lisa did all the hard work, as you can tell, so I got rusty for a second. So one of the big reasons that we bid the EAP was if you potentially left the medical, we wanted to make sure if you went with a medical carrier that didn't have an integrated EAP, that we had a backup plan in that. So if somebody reduced your rates but they didn't have an EAP. So overall, everybody is a cost except for standard, but standard you have to take their LTD, which is long-term disability. So being that you're not paying anything for it now, I don't think there's a lot to talk about, but I'm happy to answer any questions.
I have a comment to make when it talks about the minimum level of intake staff education. that we've always been told that under EAP, the actual counselors have to have master's degrees. Now, is that just a minimum? But I know that anyone we've ever referred to EAP, they've told us it's the master's degree level counseling that they get.
So intake is going to be like the initial phone call. Like I call in and I'm stressed out over a situation. So that's going to be intake. So an actual visit or consultation, that's probably correct. So we just look at kind of that entry level. The reason that came up is, and we started spreadsheeting that is, EAP for a long time, I think until we got to the last 10, 15 years, EAP was kind of a forgotten benefit. It was one of those ones you check the box that you had, but not many employees ever called. And then a lot of things started happening and more people started using it. So I think what carriers got worried about, or where they started differentiating, is somebody calls in and maybe they're suicidal and they get somebody that's just a phone person that's supposed to screen them. But the reality is that that person calling in needs a minimum level of intervention at that point. But probably any of the providers, I would imagine, have to be a master's accredited.
Is there in-network or things with EAP? Because I know for PD and for FD, most of our EAP stuff at this point in time is we are not sending them through the EAP program, because most of the people in EAP through the cities and through that the insurances are not versed in the first responder related issues. We actually have we have separate entities that we use. So I'm just curious as to this in plan, out of plan type stuff with that, because I know most of the firefighters are definitely using an outside source for that. We have several different ones, and I'm sure PD does as well.
Yeah, so I would say, a number of the carriers in the last couple of years have, especially in the last maybe year and a half, have made a more concerted effort to try and cater to public safety in that regard, meaning that they have providers that are specifically trained for first responder and some of those things. So like as an example, I know Cigna with their EAP program, they have a special option for first responders that will direct them to that. But here is what I will tell you about EAP that is unfortunately just a very kind of sad, there's not much we can do about it, is there's an overall shortage of mental health providers. Especially there's a lack of counselors, but if you get to needing a psychologist, it starts to get very limited. And if you need a psychiatrist, it's really, really limited. I'll give you an example. I had somebody, one of our clients in the Space Coast, employee called in, was very upset. They said, there's only, the EAP is horrible. There's only one child psychiatrist in the network, and he can't see my child for 6 months. We need to change EAP. Well, it has nothing to do with EAP. That guy is the only child psychiatrist in 100 miles. So there's a lack of issues. So I know I'm maybe not really answering your question, but what I would say is keeping that separate program that you have is unfortunately probably the best way to do that, to make sure you have that option. It's not that the EAPs themselves, it's not like there's something wrong with the EAP. It's just an overall lack of providers that know how to do that area especially. And almost all of our groups have some sort of separate contractual arrangement to make sure that they have those services there for first responder. I know I took a long way to but does that help a little bit, at least give you an idea of what's going on?
Yeah, it's fine. It's just, it's one of those things that at this, it's funny that that stuff just hasn't been kind of enrolled into that, where if we give somebody the EAP and they would then refer them to the proper locations. And because we're just basically being the EAP as their managers, we're just referring them to specific people and groups that do just specifically first responders.
Yeah.
So it's like we're basically being the EAP at this point, because we're taking a phone call from somebody saying, hey, I've got an issue at home. What do I do? Where do I go? And we give them the resources, and we have like resource boards for this at this point. So it's funny that the people who do that don't happen to have that access. But yeah, no, I get it.
Yeah, no, and it's unfortunate from their point of view as a provider. I mean, I hate to say this, but it's kind of cold hard reality is if they're busy, if they're filled with appointments from 8 to 5 now, a lot of the providers, right, their schedule's full. They're seeing enough patients or maybe more than they even want to see. So them taking the time, shutting their practice down to go get specially trained and dealing with first responders it just isn't a scenario that makes sense for them, because they're full, every day. It's like we were talking about with certain dentists. If they're full from 8 to 5 with patients, why would they want to take insurance and take a lower rate if people are going to come pay them anyway? So unfortunately, when you have a lack of providers, that's what happens. So, you guys want to vote on the EAP, or do you have to vote since it's included with medical?
Yeah, it's included. I would say that, we have the established network with UHC and FMIT, and if it's included in the premium, I would see.
I guess it probably doesn't need a vote, right? It would probably only need a vote if you separated it.
Yeah, I would think if you separated it, but if it's in the system, I'm going to defer to Jane on that one.
Well, why would we pay for something that we're already going to get free?
You just want to make a vote to.
Yeah, I will.
Sorry,
Yeah, I will vote to keep the EAP through FMIT UHC.
Okay.
I concur.
Likewise.
I concur.
Yep, I'm good with that.
All right, so moving on, let me just do, I'm gonna jump one line of coverage. It's in a different document, and then I'm gonna come back and I'll explain my, hold on 1 second. Hold on 1 second. So, and Janina, did you still want to do FSA and COBRA with this committee? I just want to go in the right order here.
Do we need to make a decision on that, like ASAP, or is that one that we can kind of come back to you on? Because
I'll bring everyone in the loop. We bid flexible spending account and COBRA administration. And so COBRA is obviously if an employee leaves the city, they have to be offered coverage with COBRA for medical, dental, vision, flexible spending, different things. That obviously you as employees do not really see because you only see it if you leave. Jane and her staff live and breathe it every day. So we didn't know, we just wanted to offer up, do you want to, we can go through it. We can also go through it, but sometimes what we recommend is with a change is that you see a demo of the system of whoever you want to select to make sure you like the way the process works and that it'll work with your workflow. So there's a lot of different things we can do there. So I don't want to, if you want to handle that differently, I just wanted to throw that out.
I would like to make a comment. Currently, our COBRA is handled by FMIT, actually it's United Healthcare Benefit Services. Excuse me. We recently had an ex-employee try to sue us because they said we did not give the proper notice. We were able to go back to, at least the FMIT was able to go back to United Healthcare Benefit Services and provide proof that the man did get what he was supposed to get. We just saved ourselves $12,500 in a lawsuit.
Yep.
So I'm quite comfortable with it being part of the current FMIT UHC.
Are you paying them extra to do the dental and vision
Dental and vision?
on the COBRA?
No,
Okay.
I don't believe so. I know it's already included in our premiums.
Okay.
Jane, is the flex spending, does the city have a flex spending through some other option besides like American Fidelity, the way we do it at FD, or is that something separate?
See, that's another issue, depending on what we do with the voluntary benefits. Because right now, the FSA is handled by American Fidelity.
Okay. How long will that presentation take, Sean, if we do these?
It actually won't take that long. We may want to table it after we do it because there could be other things that need to be discussed with it. But I'll go through it real quick. I'll try and get done with everything by 3:30 because I think 2 hours is enough. Let me get back to the page here. So a flexible spending account, basically what we looked at. So the one with the American Fidelity, as we look with flexible spending, what we wanted to look at is having a good independent option so that if you ever changed anything down the road, you don't potentially lose your flexible spending account and have to find a new vendor now. Something like that, the concern would be potentially being tied into something and then you lose it because maybe those benefits aren't the best. So with that, we got about 11 different quotes. A number of them are from certain medical carriers. So Cigna, on the next page, we have Florida Blue, Humana. I wouldn't recommend you go to any of those being that you're not doing the medical with them. So those kind of come off the table. It just wouldn't make sense. Overall, the price is very similar. Our clients, we have a large number with P&A. We have a large number with Benefits Workshop, and we have a decent amount with Charge Snyder. They're overall in a pretty comparable price range. They all give very good service. Employees have been happy. Those are the ones that we're most familiar with. P&A Group is one more of our clients have gone to. They're less of a big corporate administrative feel. They're very kind of, just more involved with clients as a whole in that regard. They offer some things like if you really need to talk through your plan document with them, changes, they make themselves available. Some of the other companies, that's more of a challenge. So there's a couple that we would, if we were just telling you there's maybe 2 or 3 that we would pare down to and suggest that you do a 30-minute demo call with them, the people that are going to be working with the system, to see if that works well into your workflow. It's not really a right or wrong.
Yeah, I'm sorry, I didn't mean to interrupt, but Jane, I just think this is going to be something that if we're going to think about doing this, one, we have to compare it to American Fidelity because that's what it is. So, and since they don't have that as a comparison to even show the differences in what that would cost, this may be something we want to look at a different date when we actually have what do we pay for American Fidelity for that, plus all of the other options that American Fidelity offers versus.
And actually, and I'll say one thing. So thank you, Nina. Nina just texted me. Garing Group actually offered as a part of our services. Now, we are not a TPA that does this because we don't want to be blended with that, but where we will provide that to you. So there's actually, it's included in our contract, but we also, we never want to come to a client and say, with us, you only get this one. We want you to have that choice. So that's why we went. That's why we did secure these proposals. But Janina, I'm sorry, I forgot that ahead of time. So I don't know if that messes up anything on the purchasing end since there's no cost. I don't know if that helps a little bit with that, Craig.
In my mind, it does. Right now, American Fidelity, when we originally went with them back in 2001, the deal we had with them, we looked into two, or our mandate, let me back up a bit. Our mandate was to get the Section 125, the FSA and the dependent daycare at no cost to the city. We did some research and found out at that point there were only two companies that would do that, Aflac and American Fidelity. At that time, American Fidelity was the better match. So they actually come in, and the deal is that we had to allow them to sell at least two products in exchange for them doing the FSA and dependent daycare at no cost. I'm not sure at this point whether are we going to have a discussion later about the voluntary benefits through American Fidelity. I think that would be the time to kind of tie in, but I don't know how anybody else feels, but I can tell you that so far we've been impressed with your staff and how they've handled things. So I would have no objection if it's part of our contract to have the Garing Group do it. But then that's up to you, Janina. Is that something we can do?
Yeah, and we can talk about that. So I think we, we could possibly, if you end up, I think we included Cobra or but there's no cost for Cobra. So we could just talk about it as long as it's within the purchasing rules. If we could switch FSA out for Cobra, they're probably going to be similar in that regard. So.
Okay.
I might have misspoke on that. I said Cobra and FSA independently. So maybe for Cobra and FSA, we'll just table those and we'll discuss on the back end. And the one thing for the committee that we would be concerned about is we don't ever like the idea that in order to get something or keep something like the FSA, you have to select a particular line of coverage. Because my fear is, that line of coverage, if you have an inferior line of coverage, but then you're getting something else for it, I would much rather the employees get the absolute best line of coverage for that, and then we worry about the other. We don't ever want you to feel hamstringed into something that does that. So we do have the voluntary. I'm a little worried about time on all of the voluntary because we had a guy that worked for us that said comparing voluntary coverages is like looking at an apple, an orange, a banana, and a fish. It's very hard to compare, and I don't know time-wise. We could go through it, or potentially we could schedule a follow-up for those voluntary lines of coverage, and we could send that out because we have it done.
Yeah, can we
could
just,
send that to the committee ahead of time so they get to study it a little bit more. Is everybody kind of good with that? I guess I don't know. Sorry, I guess we can't see your face. Hold on, give us a second. We got to unplug. All right, there we go.
I'm good with deferring till later. I do have one comment that just while I'm remembering it, on the FSA, I will say one thing I think would be very important is how easy it is to use. Like I will say that about the current one, they do have the app and you take a picture. I'm just hoping that I would imagine Garing has the same platform, same type of platform.
Yeah, so again, we don't do it in-house. We would use one of those vendors. So we want you guys to be comfortable with, who you choose. So we'll take a look at that. And I'll talk with Jane and kind of her staff about some of those things. And we'll figure out a way to get into some of the things that don't show on the spreadsheet, right? Like being able to take, a picture in the app and some of those, and we'll figure out maybe some of those key drivers. I guess if, is it okay, Jane, if they just sent Jane like a list of any hot buttons on that coverage that's important to them, so we could.
Yeah, while we're still evaluating it, yeah.
Yeah, like if they could just, so Paula, if you don't mind, if you could just, and Jane can forward it to us, if you can just put, anything you really like or dislike about the current program, if you have any feedback, and we will, we'll take that. That way we can make sure we get the answers back on that.
Will do.
All right, so I said 3:30. I'm gonna do my best. But since we don't have to do all those ancillary products, we might be able to get pretty close. So next we are going to look at the life and accidental death and dismemberment. Overall, I am not going to go through all the different classes of benefits and everything. I'm going to point you guys to the red and blue again. Overall, you have your renewal with Hartford. We have a 12.5% increase on the basic life. The AD&D stayed the same. We have the retiree life was a 17% increase, but again, not a lot of money in that. For overall 12.8% increase with the Hartford, which is again $6,300. So keep perspective on dollars. Cigna, which Cigna has entered into an agreement. So Cigna, this is Cigna Life and Disability. They are owned by Cigna, but they're essentially a separate company. On paper, they have agreed to be purchased by New York Life. So we have a lot of clients with, I'm trying to figure out how to zoom this better, with Cigna. In name, they're supposed to be changing to New York Life if this goes through. Nothing else is supposed to change. They're taking over the staff, the computer systems, basically everything, the whole kit and caboodle comes over. One takeaway, some grandfathered retirees that have 15,000, they would only offer 2,500. I do not know if that's a contractual obligation or not, Jane, and I don't know if we would have to look. Not most people know that off the top of their head. So I don't know if that's a concern with that takeaway.
There's no, as far as I know, there's no contractual requirement.
Okay.
But we've always extended it. Now that group is getting smaller by daily.
Yeah.
One group just disappeared because we had one retiree pass on.
Okay.
So it's not a big thing, but some of those people, for example, the people that have retired since 1995, they're paying $100 a month in their premium.
For that 15,000?
Yeah, well, it's 25 until they hit 70 and
Oh, okay.
15, but that's a lot of money.
Mm-hmm.
So, I don't know.
So Cigna was no increase. And I'm going to go quick, guys. I'm sorry. Florida Blue, US Able, it's called, is their subsidiary, and Standard were both 0. You have a little bit of a reduction with Standard. Of the two of those, Standard, being that you're not selecting Florida Blue with medical, Standard keeps you kind of independent of that tie. And then you have Sun Life, a 2.4% increase. So let me hit the supplemental as well, because you really would not separate basic and supplemental. So supplemental, Hartford, is no change. Cigna would be no change. Everything is, sorry, doing it with my fingers there. Now I'll tab down. Sorry about that, guys. Operator error. All right, let's start over. Okay, so we have Cigna. There's a little bit of enhancement on dependent supplemental life. They can get 50%. They added a benefit 50% of the employee amount.
Yeah, that's added. We currently don't offer that.
Yeah, so that's an enhancement. Now, I will say from a bid point of view, just because they put it on there, you don't necessarily, it's not like you would have to take that. You could always go back and say, you know, we would confirm to get it right and say, we don't have that now. We appreciate that you offered it, but not interested. You always have that option. They're just trying to make it look more attractive. Standard alternate 3, what they did is they offered you 100,000 guaranteed issue. So somebody that comes on new guaranteed issue, they've got $100,000 guarantee. The other thing that you can always try and negotiate if you're changing is, will they give you a one-time open enrollment, meaning even if somebody had passed up the opportunity in the past, they could take it. That's something you normally have to negotiate, but a lot of times we're successful in getting. So of all these, I think Standard and Cigna are the two most attractive in that. Let me do disability and then we'll kind of wrap these all up together. You have Hartford for your long-term disability. Cigna matched the schedule of benefits, so you have a 17.5% increase. Cigna is a 19.3. You have a 29%. And I might have pulled the wrong document again. The percentage, the dollar amounts didn't look right there. And let me pull that up. And then Sun Life. I'm going to unplug for a second and see if I somehow got the wrong one again.
Yes, so Sean, the for standard, theirs was 21.1%, but that also did include additional EAP service for 3 face-to-face for those who are enrolled in LTD. They did offer something else additional, like if, for instance, your sworn firefighters are not covered under the LTD, so they did allow like a 25 cents PEPM additional if they wanted to have those individuals enrolled in the plan. And then for Sun Life was they offered bundled rates, one with STD and one without STD as well.
We're at kind of the 2-hour mark.
Yeah,
You think I know there's a lot on there and I imagine everybody's starting to get a little overwhelmed. For the follow-up meeting, do you want us to maybe send out the life and disability, even though we covered it, and then send out the work site, let everybody do a little bit of studying, and then we'll have a much shorter follow-up meeting? Is that, does that work for you guys? I think keeping everybody here for another hour to talk about is probably more than anybody wants to handle in one day. I think our next meeting, we got through the big lines of coverage. I think everybody's pretty happy with the results on those. So I think maybe we'll table the rest of those and send you guys those documents ahead of time. And then answer any questions and get to a vote. Does that sound good with you guys?
That sounds good.
Okay, so while Sean's working that, I'm just gonna wrap up. We agreed on the current medical, the dental, the vision with possible negotiation on a couple of the rates. And then the other items that Sean just discussed, he's gonna send us the, read ahead so we can look it over, all the information he just provided on the insurance life and the LTD. And then we will send out another meeting invite and hopefully be able to wrap it up.
Sounds good.
Are there
I
any
wanted to
questions?
say, well, I just want to make a comment. I wanted to thank the Garing team for the work. It's very helpful, and the way you presented it with the red and the blue, and that's very, very good. A lot of work went into that, I could tell.
Thank you.
Okay, are there any other questions or comments? And we're also going to get a copy of the presentation that he gave today. So we'll have that for the files if you guys want to look over anything else. That'll be available. That's all I have.
Thanks for everything. Have a good day.
All right.
Have a great evening.
Thank you, everyone.
Bye, everyone.
Bye.
Okay. I think we just